So we'll get started with today's session for today. Thank you everyone for coming. We're going to be talking about how infection control programs affect everything in your building. So to remind you all, we are the IPRO QIN-QIO. IPRO holds the federally funded Medicare QIO contract for 12 regions across the United States, as shown here. IPRO handles New York, New Jersey, Ohio, and works with health-centric advisors, which covers Connecticut, Maine, Massachusetts, New Hampshire, Rhode Island, and Vermont, as well as Clarence in Maryland, Delaware, and District of Columbia. So, Mary Ellen, do you want to share some information about the COVID boosters before we get into today's topic?
Yeah, so just a reminder to folks that with the vaccine booster just coming out, that CDC has recommended bivalent booster based on FDA emergency use authorization approval. So it does offer better protection against the most recently circulating COVID-19 variant, Omicron, and it does restore protection for the original strain of COVID-19 and provides broader coverage. And more research is coming out about this booster vaccine with really positive results as far as even preventing long COVID symptoms, something that we're learning about on an ongoing basis. So certainly more to come, but it looks like this booster is really is showing some optimal effects. So certainly encourage folks to get it. In the spirit of transparency, I got mine last week and it wasn't too bad for sure. And on that note, we are also, we had our inaugural session of Vax Chat last week. For those of you who are able to join, we had some great participation. This is a every other week series. It's 15 minutes of conversation on vaccine specific topics. And our next one on October 6th is about the COVID vaccine booster. So please join. The registration link will actually register you for all the sessions. So you can kind of pick and choose depending on the topics of interest to join us. Next slide. And these are the links to documents we provided at last week's call, but just they're great resources as far as visually the schedule for the COVID-19 vaccine, as well as the interim clinical considerations. We are monitoring this because this changes, as you know, all the time. So certainly bookmark this page, but we will also keep you updated as these recommendations change as they do. Next slide.
Thanks, Mary Ellen. So I wanted to share as well with everyone that today there is supposed to be a webinar at 1:30. They actually sent an email yesterday changing it to 12:30, but then back to 1:30. So I'm honestly not sure what time the real time is supposed to be because CDC kept changing it. But this is the registration link if you want to check it out. They're going to be talking about the healthcare personnel influenza vaccination summary data, which the nursing homes now have to begin to report within the NHSN portal. So normally, if you are familiar with entering your NHSN data, for COVID-19, you can see that there are two tabs for COVID-19 for residents and healthcare workers, but there are also some tabs for the influenza vaccinations that you'll have to be putting in for the staff as well. So more information, this is going to be related to your quality reporting program and a financial aspect component for fiscal year, I believe, 2024. So you definitely want to make sure that you stay on top of this. And with that, I'll pass it over to Melanie.
Thank you, Josh. Thank you for everyone joining. So today's learning objectives identify the regulatory requirements for an IP and long-term care setting. Describe the roles for each team member has in the prevention of infections. Review the CMS long-term care survey changes as they relate to infection prevention and control. And the NHSN updates for influenza vaccination requirements that start in October 1st. Go ahead, next slide. Regulatory requirements for infection prevention in long-term care settings. So significant changes in the infection control. requires facility to have a part-time infection preventionist. We'll talk a little bit more what that means. While the requirements is to have at least a part-time IP, the IP must meet the needs of the facility. The IP must physically work on site. So that actually means that you cannot have the oversight to or have the IP from the hospital that's covering the facilities. That used to be that you could collaborate with the IP at a hospital and have that kind of oversight from more of a policy standpoint, but they actually do have to work on site and cannot be an off-site consultant or work in a separate location. IP role is critical to mitigating infectious disease through an effective infection prevention and control program, and IPs must be specialized in training. I think we certainly have seen over this last 2 years how important it is to have good practices and procedures related to infection prevention and control. We've also seen how facilities functional with IPs that have experience in training versus when there's not somebody assigned to that responsibility. There's a significant difference, and that is why there's been these changes and they're being implemented, because there are much better outcomes in nursing homes that have somebody who's trained and responsible for building the program, because an IP is not just somebody walking around checking to see if people are washing their hands. It's actually part of your program to make sure that you're doing all the things necessary to protect the residents and your staff. So next slide, please. So in infection prevention, the facility must designate one or more individual as the IP or responsible for the program. And if you look at your state operations manual, there is a large section about what an IP is responsible for and what are the components of that responsibility is. So they must have primary professional training in nursing, medical technology, microbiology, epidemiology, or other related fields. So you actually do need somebody who's qualified to even start the training. And be qualified by education, training, experience, or certification, work at least part-time in the facility, and have completed specialized training in infection prevention and control. So part-time at the facility. So this is your opportunity as an IP, or if you're in the leadership role at the facility, DON, administrator, it's really your opportunity to take a look at what the responsibility and expectation of your IP is, and make sure that you've designated the proper time for that person to do all of the things that are necessary to protect your patients, residents, and staff. So next slide, please. The intention of this regulation is to ensure that facilities designate a qualified individual on site who's responsible for implementing the program and activities to prevent infection control. So let's kind of break that down. For if we're talking about intention, you're talking about survey. So your survey team walks in, your IP's on a medication cart, and the policies haven't been updated because there's just been no time, because the reality of infection prevention and control and what's been happening in the world of nursing homes is really challenging. Your staffing is a problem, but they now identify multiple deficient practice. So that is where you have the opportunity to really look, do you have a qualified person who's actually responsible for the infection prevention and control plan? Are you giving that person the time that's necessary? The IP must be professionally trained. We talked about that. A physician's pharmacist and a physician assistant also would qualify as the related fields. Nurses, medical technologists, microbiology, epidemiologists. And so qualified, the IP must be qualified by education. So this is additional training. It's not just that you're a nurse and now you can be the IP. You actually do need to go through some additional training, and we have some links for additional training further on. But there's the Certification in Infection Prevention and Control, CIC, which is conducted by the Certification Board of Infection Control and Epidemiology. And actually right now, there is a long-term care CIC beta test that's available through the CBIC. So you can go ahead and pull that. You can look up CBIC and you can find that long-term care beta test. And if you're an experienced IP working in long-term care, you may qualify to take that test. Next slide, please. So the infection preventionist IP hours of work, at least part-time, varies based on the facility and the population census and specialized units. Must physically work on site, not off-site as a corporate office. So we talked a little bit about that as well. This is where you really want to look at your facility-based assessment and identify what are your risks in the organization for infection prevention issues. Do you have a vent unit? Do you have a big dementia population that if in fact there is a respiratory virus, it spreads rampantly throughout the unit? Who are you serving? And have you identified a proper amount of hours necessary to properly protect your patients, residents, and staff, again, and go through your policies and procedures. And certainly with all of the guidance changes and regulation changes and your state regulation changes, there's a lot of work just navigating through the regulation, federal, state, and guidance. So next slide, please. Your IP, so looking at if you have part-time folks, making sure that they're working at the time that you're doing your coffee committees, that they're part of your quality assurance and assessment and assurance committees. They are supposed to be there, so they must be in attendance at the committees. In order to be considered an active participant, the IP should attend each QAA meeting. If the IP cannot attend, another staff member should report on the IP's behalf. So it is important that they're actually joining the process. I see there's a lot going on in chat. Is there some questions that we should be answering?
There were some questions related to the CDC, the certification in infection prevention and control. So a lot of participants had recommended the free training on the CDC that they can take, and some other individuals had mentioned going through APIC and CBIC.
Great, thank you. Next slide. So there has been some additional updates too with water management, extensive new guidance on minimizing outbreaks for I always say it wrong, Legionellosis, providing feedback to providers on prescribing practices and the facility is no longer required as an element of compliance. And then influenza pneumococcal immunization, there was some revisions with the pneumococcal changes. So certainly you want to be aware of what pneumococcal vaccines you should be providing and making sure you have address your water management, because that can be a real problem in a facility. Next slide, please. So this is the CMS memorandum, summary QSO 2219 nursing home, and that's where we're talking about the phase 2 and phase 3 changes, and that's all of what we're saying today. And the October 24th, the surveyor guidance actually, they're going to start surveying you on those changes. So be prepared and be aware. And there's some residents' rights changes related to being able to search their rooms and making sure people agree with that. So take a look at that QSO and make sure you're familiar with it. This is a good opportunity for me to also just make sure you all are aware that their QSO-20-38 NH was revised. It was revised on 9/23/2022. And this is the one that's the interim final rule for CMS at 3401 IFC, additional policy and regulatory revisions in response to the COVID-19 public health emergency related to long-term care facility testing requirements. I did add the link at the beginning. So anyone, I don't know, Josh, if you can just copy and paste that below so that people can get to that. The highlighted in red routine testing of asymptomatic staff is no longer recommended, but may be performed at the discretion of the facility, and updated recommendations for testing individuals who have recovered for COVID-19. So this could be a huge thing for all of you folks. If you haven't seen it, you want to take a look at it. You also always want to remember to look at this against your state guidance. So I needed to put that plug in because that's a new change. So go ahead, next slide, please. So these revisions, we hope to be strengthening our infection control guidance to address frequently cited issues such as hand hygiene, transmission-based precautions, surveillance, infectious disease. And as we talked about, well, the requirement to have an IP at least part-time, the facilities really are responsible for effective IPCP and should ensure the role of the IP is tailored to meet the needs of the facility. I really can't state that enough. You don't want to put this into a little, nope, it's a part-time position. It's always been a part-time position. That's what we have. We don't have the budget for something more. If you really need to look at your bed size and all of the categories that you're serving. And if you've had a lot of outbreaks, this might be an opportunity to readdress this measure. And CDC and CMS developed some training for the IP training and special topics such as transmission-based precautions and antibiotic stewardship program. And we are hearing that the antibiotic stewardship is a focus of some surveys. So making sure you actually do have an antibiotic stewardship program in your facility, that you're monitoring it, you're assessing it, you're providing feedback, and you're making changes necessary. And that's right in the state operations manual, what your antibiotic stewardship program should look like. Next slide, please. And so here's some links to some of the specialized training, and we can just copy and paste them and put them into the chat so you can have some of them. Many of them are free, but there are a couple that do cost money. And I think this long-term care certification and infection prevention, that beta test, I think that's the beta test. That's at a reduced cost because it's a beta test. And when it does open up live for everyone at some point, it's going to double in cost. So it's a good time to take a peek at it. Next slide, please. So I'm going to turn it over to Mary Ellen.
Thanks, Melanie. So as Melanie mentioned, the IP role has really transformed, especially since the pandemic. And I think the new regulations really reflect that. So what we want to shift gears and talk about is the team members' role, because again, the IP, whether they're part-time or in our minds, full-time would be better for the amount of responsibilities that they have. But infection control, as we've seen with the pandemic, is a team sport. And so it really is critical to have a team that supports infection control, because the IP is not there 24/7. So, and this isn't a new concept. The CMS has defined interdisciplinary in the long-term care setting to mean that professional disciplines will work together to provide the greatest benefit to the resident. So the language has been out there outside of the specialty of infection control. And so CMS wants these interdisciplinary teams, regardless of IP, but certainly this is a good way to support that role expanding in the IP world, in the sense that skilled care should include the resident representative, or I know that there are patient and family councils involved now, so it's a more holistic type of teamwork. It can include the physician, the registered nurse, the nurse's aide, dietary, the lab, pharmacy, different professionals, and non-clinical staff as well to be part of your team. Next slide, please. So I chose a few departments to kind of focus on to get you thinking about some of the areas where the IP is really needs to be part of whether it's collaboration or communication or just being aware of what's going on. And, we didn't delve into leadership, but leadership is one of the most important parts of that team because they will support the IP. You need strong leadership support to be able to impact change, to implement some of these regulations and make sure that they're being done properly. So I'll start with nursing. I mean, nursing, we know the team itself is promoting infection control simply by following standard and transmission-based precautions. So important. But staff are the eyes and ears of the IP. They can serve as champions, whether it's for promoting vaccines or hand hygiene observations or PPE use, just that collegial support to say, hey, you might not be wearing your mask correctly, or you need to wear this to go into the room. It just added support to make sure that we're following these isolation precautions. Auditing assist, I've heard this before that, sometimes I know folks wear many different hats, but if you have nursing supervisors, oftentimes in the facility, they'll assist with auditing hand hygiene just to get that kind of data assessment skills. You've got frontline staff that are looking and monitoring for early signs and symptoms of infection and can implement rapid intervention, and certainly health promotion in all walks of the residents' care, but really encouraging residents in regards to hand hygiene, respiratory etiquette, which is so difficult for them, or even having that personal conversation regarding vaccinations. The other area is oral hygiene, which I think people don't think about in terms of infection control, but a lot of infections are linked to poor oral hygiene. And so nursing staff is doing this already with promoting good oral hygiene care. So just something to consider. Next slide. Food and nutrition services. This is a really important group in terms of promoting infection control. And we've seen that with folks answering our questions about what kinds of things surveyors are looking at. And it seems that this department really gets scrutinized during surveys for food handling, preparation, storage. Are they following proper cleaning and disinfecting practices? How is the hand hygiene and respiratory etiquette in this department? Because it's really critical. We know long-term care residents are at risk for foodborne illness by nature of age-related changes, medications they're on, and they eat in congregate settings. Next slide, please. Environmental services. I feel environmental services are honorary IPs because as much as we practice the control of infection, they're really concentrating on the environment, which is a huge transmission base for pathogens. So cleaning and disinfection is essential to preventing that spread. Collaboration between IP and EVS can take on many different nuances because they can be sitting on your committee as part of just the infection control team, but they're also collaborating in terms of what's the appropriate cleaning product for your home. Understanding how that product works, including dwell times, what's the difference between routine cleaning and terminal cleaning process. If they're not doing it correctly, you're going to have fallout from that. Trash removal, medical waste, an awful lot on linen handling and storage. I included laundry. I know some facilities have outside contractors as far as laundry goes. You may do it in-house, but whatever is applicable, that the IP has to be involved in knowing what that process is. So the scope of practice for the IP is just huge. So these team members really assist with helping support the IP program. And hand hygiene supplies, depending on your facility, some EVS departments are responsible for making sure that the alcohol-based hand rub dispensers are full and swapping them out and that kind of thing. Next slide. Rehab services I included because that's sometimes overlooked. If you have a resident who's going to rehab outside of their room, there's a department for it. Are the treatment tables being cleaned? Are the gate bells being cleaned? Or if the resident is having in-room rehab services, that rehab member has to follow isolation precautions, know that dedicated equipment may be feasible, or how to properly clean and disinfect if it's equipment they're using that they have to take back to their department. Next slide. Lab services, they may be private, they may be on-site, but regardless, they need to be following proper specimen collection and promoting integrity of that specimen. Do they have procedures for specimen holding and transport? All of those things, you don't think about it sometimes, sort of that supply chain, if you will. Where does that specimen, what are the steps from the resident to where it's going to be processed? What's going on to make sure that there's no potential contamination or loss of integrity? They also assist with antimicrobial stewardship, which is a huge focus now for long-term care, providing antibiogram reports. And they can collaborate to ensure that drug-resistant organisms are rapidly identified and reported. And that's a huge challenge, is trying to keep on top of surveillance for these kind of organisms that are pathogenic in nature and opportunistic. So they're always looking for a way in. So the lab services are really important. Next slide. Pharmacy, again, they're part of your team because they are the safe medication management gurus. You want to prevent possible contamination with your medication program, and certainly safe handling of injections and vials has been and will continue to be extremely important in infection control. And they are a critical member of your antimicrobial stewardship program. Next slide. Support services, I just touched on a few because as the resident's home is a much more holistic area than a hospital, they have the opportunity to have different services that you wouldn't consider that are non-clinical and very important. But these additional activities also increase the risk for transmission of infection. So it's important to think about who in the support services would be beneficial to be on that team as well. Next slide. So I'm going to turn it back over to Melanie. I just gave you just a flavor of some of the departments you should consider as part of your interdisciplinary team to promote that infection control.
Thank you, Mary Ellen. So I just wanted to make sure that everyone is aware of how to find the CMS survey information. It's the pathways to basically it's your cheat sheets to what the surveyors use to do their reviews. So Josh, are you able to click on the top link and we can walk them through it quickly because I know we only have 5 minutes. All right, so that link brings you to this page. If you scroll down to survey resources with staff vaccination documents, you can click on that. And this is a zip file, so there will be multiple things within this zip file, but you want to get this far and then kind of go ahead and click on the survey resources. So this is all the information you might want as a facility. If you go to the LTC survey pathways, click on that, and then you hit the infection prevention and control and immunization. And if you click on that, so here's your cheat sheet. So I recommend that you all take this form and have somebody walk through it to identify, do you feel that you have a policy or a procedure right there for standard and transmission-based precautions, resident care of COVID-19, you have an ICPC standards, policies, procedures, infection surveillance, do you have a surveillance process, visitor entry, how did that happen when the surveyors walked in, how did they get screened, staff and resident COVID-19 testing. This hasn't been updated with the new recommendations, but this is what you have. So you can go through this and make sure that you have all of the components that you need to have a good survey. Very high level focus on precautions, proper standard precautions, hand hygiene, source control for COVID-19, but you get the gist where you can find it and you can print it off and do your own. Please repeat how to get to the pathway. So if we put the CMS, these are the downloadable areas. And
Melanie, I just put this link to the CMS website in chat right now. So if people want to pull up and follow along, you're going to want to come down and click on this link here for survey resources with staff.
And I want to just point out, if you look at these dates, 9/26/2022, there is something that's changed in there. So always be looking at your dates. Sorry, Josh, go ahead.
Yep, no problem. So you're going to want to click on this link here for survey resources with staff vaccine documents. and it's going to prompt you to download. I already downloaded it, but you'll get a download, and you're going to open up the survey resources with stat vaccine documents. You're going to pull up that folder, and then you're going to click on survey resources, and then click on the long-term care survey pathways. So these are the things that the surveyors are all going to be looking for when they're doing survey for each of these departments and different aspects within your facility. So in this case, we're talking about infection control today. You want to click on that infection prevention and control and immunization PDF, and it's going to pull up the surveyor sheet for all the things that they're going to take a look at when they survey your building. So it's a very great resource for you to take back and take a look at and make sure that you're in compliance with a lot of these things that the surveyors are going to be looking for. And I'll be following up again with instructions on how to do this again by the end of the week to everyone who's participated and registered for today's session as well.
And Josh, the big thing is that first, when you download it, it's going to download as a zip file. So you know, it might be a little unusual, but if you click on it, it'll eventually open and you'll be able to follow the steps to get to where you need to go.
Perfect.
Thank you, Josh. Next slide, please.
So we'll just talk about this quickly in the interest of time for folks that want to get on the NHSN call, but this is basically what NHSN is going to be talking about, the new influenza reporting requirements. The takeaway from this is while you have to monitor influenza vaccination coverage among the healthcare personnel in your building, you only have to submit it to NHSN one time, and that is in May. But the data collection period is from October 1 through March 31st. Next slide. There's not a lot out there, so I am just giving you a flavor of what I think NHSN is going to talk about today. But the bottom line is you need to look at every healthcare personnel that is in your building that needs to be included in that summary of vaccine. And again, it's to meet the minimum data requirements that they're asking for at minimum, you know, as if you didn't have enough to do, but once, and that is in May to submit it. But they do suggest that you think of a process that makes it as easy as possible for you, possibly to collect it at 30-day increments so that you're collecting that data for October. Don't wait till March to collect it. Do it month to month to month to save you that strain of collecting this information. Next slide. The denominator, this may change depending on the call today, but this has historically been who NHSN wants listed in that report. That includes your employees, licensed independent practitioners that don't necessarily work for you, but if they come into your building for at least one working day between October 1 through March 31st, they count. Adult students, contract personnel, this has been a hot issue. It may be required or optional. I'm not sure. It used to be optional, then they went to required with the hospital setting. So we'll listen for that with what NHSN has to say for the long-term care setting. Next slide. And I just showed up a screenshot of what the data report looks like. So you kind of get an idea of it. Some people have downloaded it, printed this down, and just kind of crunch the numbers on paper. That's what I like to do. And then collected all that information and submitted it in one shot to NHSN in May. So again, I'm sure NHSN is going to dump all the paperwork side of this and the resources after this presentation, but this is just give you a preview of what it may look like for the season. Next slide. And the resources that we have, which we'll share with you.
So while I have everyone here, we actually got notification from CMS to help ensure that all of our nursing homes in our collaborative have the support related to COVID-19 and emergency preparedness. We put together a survey here. So if one of the team members can put this link into chat, it would be really helpful for us for you to fill that out, because based on the responses that you provide us, it'll provide us with meaningful information about what support your facility actually needs so that we can follow up with you and get you any additional tools or resources. So if you could just take a minute to just go through that, it's not anything that's going to kill you, I promise. And with that, I'll go to the questions for today. Does anyone have any questions they want to put in chat, or if they want to pull themselves off mute from today's session?
Can you move forward to our contact information so maybe they can do a print screen? Because some people are asking if they have problems getting to that site, could they contact us?
Sure, just give me 1 second. And I see there's a couple of questions in chat about the slides being available. So we actually have to go through a 508 compliance. All of the information related to CMS has to go through that compliance to make sure that people with disabilities and everything can receive can appropriately review the recording and such. So I'm going to be pulling up our contact information. Just give me 1 second. I apologize.
We are repeating this. There's a recorded session of this presentation tomorrow. I believe, Melanie, it's at 3:30. Correct me if I'm wrong.
That's correct.
Yeah, for anyone who's missed it, the session is recorded for tomorrow at 3:30 with a live Q&A after. So if you missed part of it, or others who would like to attend, definitely.
We're also going to put in chat access to the programs for the rest of the week. We do have a presentation on Thursday that is a PowerPoint that we're going to provide to all of you to be able to provide to your resident council and family council related to COVID-19 booster vaccines, because we hear that sometimes that's a hard group to get. The families are not saying yes. So we did the work. You'll have all that you need to be able to get out there and educate. So join us for that.
Yep. So if you're looking for the slides of the recordings, we have the series webpage here that I put into chat. It's still going through the process of having several of the other sessions being uploaded. So we don't have the most recent ones as of yet. But if you just keep coming back to the page, they'll eventually all be there. All right, perfect. Well, I don't see anything else in chat. So we'll end the session for today. Again, we have the recording of today's session that's going to be played tomorrow at 3:30. So if you know anyone that could benefit from reviewing this session, definitely encourage them to participate tomorrow. And then we also have our Vax Chat and IP3 sessions on Thursday. So definitely come to that as well.
And I just posted, someone had asked for the NHSN registration link. So hopefully I captured it all. For anybody who's looking to jump on that session next.
Perfect. Okay, thank you so much, everyone. Have a good day.